Welcome everyone to the latest webinar with cosmetic laser dermatology. I am very excited to be here today with our very own Dr. William Groff to talk about a very important topic, one of our proprietary treatments here at CL Derm called ThermiSculpt. Before we get into ThermiSculpt, just a little bit about the practice, because not all of you are existing patients. We were established in 2010. We are in beautiful San Diego near UTC, and we are very proud to have over 60 lasers and devices. We actually have 8 surgeons, dermatologists at this point, and we have more lasers and energy devices almost than any other practice in the world. So now let me tell you a little bit about Dr. Groff himself. If you haven't seen him on the news or in San Diego Magazine or Union Tribune, then you've been missing out, because he has been voted best cosmetic dermatologist and best cosmetic surgeon for 6 years in a row by the San Diego Union Tribune and the La Jolla Light. And I tell you, I promise you, we do not pay for that. I wish we could, but it is real. It is you guys voting. So thank you so much. Dr. Groff has over 24 years of experience with lasers, which is pretty much right when lasers probably first got invented. And he's given over 100 different lectures around in 10 different countries on lasers, and he publishes on lasers. He's a trainer for many companies about injectables, so he really is an expert here. But I do want to remind everyone that all of our dermatologists at Cosmetic Laser Dermatology do offer all of these treatments, and even though Dr. Groff today is talking only about ThermiSculpt, he also does injectables and body sculpting and other treatments as well. So without further ado, Dr. Groff, the floor is yours.
Thank you. So a lot of you are probably wondering, what is ThermiSculpt? And it's a procedure that I started doing probably about 10 or 12 years ago when the ThermiTight machine came out. So the ThermiTight machine came out, and it's basically a device that delivers radiofrequency energy to the undersurface of the skin, causing tissue tightening. And when we first received the machine, that's exactly what we were doing with the machine. But then as I got to use the machine more and more, I'm like, well, why are we leaving all this fat? Because a lot of patients that come in and see us have, a small amount of fat, a little bit of fat, or a lot of fat. And no matter what, if you have any fat underneath this area, it weighs the skin down. So in my mind, I'm like, why are we leaving this fat behind when we're doing these ThermiTight procedures? So I started literally using a hand suction device to suction out the fat first, and then I would do the ThermiTight procedure, which you'll see a video here in a moment about how it works exactly. But so the combination of removing the fat and tightening the skin was way better than either one alone, really. In most cases, that's true. Now, in the rare patient that has really no fat there, we can still do ThermiTight only, and you will get some really nice tightening. But it really is, like, as far as the procedures we have here, we have so many lasers, so many devices, and I've been doing this for 24 years. This is certainly the most impactful treatment that I've ever done or performed or seen that can be done on the neck and done safely. So I'm going to forward to the next slide here. So this video. You may want to turn your volume up a bit. I think it's a little quiet, but I'm going to walk you through. It's about 3 or 4 minutes. Walk you through how the procedure proceeds.
So today we're going to be doing one of my favorite procedures, which is called ThermiTight. ThermiTight is a procedure which is designed to tighten the skin, particularly underneath the chin and in the neck area. Can you extend up? So when patients have a little bit of laxity in this area, this is the best treatment that I've seen in 17 years for this area. So we're going to get started first. We're going to numb this area, and then I'll show you there's a probe that goes under the skin that actually heats the skin and causes it to contract. You can actually melt the fat with it as well. So we're going to get started with the numbing. As you can see, we're just going to put a little bit of anesthetic on the right side of the neck here. And then I'm going to have the patient lift their chin up nice and high. And we'll do a little bit here. And then now we're going to swing around to this side and do the same thing. A little bit of anesthetic. Okay, good. Perfect. So now we're injecting the tumescent anesthetic solution, which will numb up the entire neck area. You can see how quickly we can do this. And there's very little discomfort because I already placed a little bit of lidocaine in the entry point. So we're starting the actual ThermiTight procedure. You can see that I have the ThermiTight probe is underneath the skin. So the beauty of this procedure is you're able to actually direct the radiofrequency energy to the undersurface of the skin where you need it. So you can get that tissue contraction or tightening that you want. And you can see we have a camera here that monitors the temperature, so we know exactly what the temperature of the skin is at all times. And we have this infrared monitor which helps us track the heating process. So generally this can take anywhere from 7 to 12 minutes to get the temperature to what we want for tissue contraction. So you can see the patient's completely numb, not having any discomfort at all, and we're just slowly going to deliver this energy to this submental or the area under the chin. Okay, so we just finished doing the ThermiTight portion. Now we like to finish that off after we've used the device to kind of melt the fat and cause some tissue contraction. We're going to remove that melted fat with this cannula here. So this is the final part of the procedure for us, and she'll do great. Here we go. So you can see that in the tube there, you can see some of the fat that's coming out. So this is just our way of making this procedure the best it can possibly be. You got the tissue contraction from the radiofrequency device, but then we actually remove the fat too, so it's a win-win all around and we get the best result possible. She'll drive herself home from this procedure, which is amazing. There's no reason patients can't be awake and alert for this procedure. They have no pain because we numb them completely, so they can drive themselves home, which is great.
Okay, so the reason I love that procedure, or this procedure, is the other great thing that I mentioned in the video is that patients can literally drive themselves here and drive themselves home. So, but we know we have a full research center here at our office. We know through the many studies that we've done that you can smooth the surface of the skin by applying heat of about 42 degrees Celsius. But to actually get tissue tightening, you have to approach a temperature of 55 to 65 degrees Celsius. And that's exactly what we do in the ThermiTight procedure. And you can melt fat if you go above 70, but I prefer to actually just physically remove it. That way it's gone and you get a really nice, pretty dramatic improvement in many cases. So to give you an idea of the size of the tools that I'm using when I do this procedure, obviously on the right-hand side, you can see that's the size of your standard ballpoint pen. The ThermiProbe, you can see, as I often describe it to patients, it's thin like a piece of spaghetti. So it fits through that tiny little poke hole that I make underneath the chin. This slides right in beautifully and doesn't leave any scarring. And the same, the cannula is the instrument that was hooked up to that hose where I was able to suck out any fat that might be in the submental or area underneath the chin. So again, it's non-surgical. The patient's wide awake. We can give you a Valium or a Percocet or something, or an Ativan if you're nervous, but 95% of the patients don't take anything and they drive themselves home. It takes me 35 to 45 minutes. So it's really a great procedure. It takes little time, very little downtime. Patients might I'm going to show you some pictures here in a moment, but you might get a little bit of bruising, maybe a little bit of swelling, but you can really get back to your activities in just a couple of days. No problem. So everyone wants to know, how are the results? So as a physician discussing with patients, I think one of the most important things is to decide who you're going to see for a procedure is you want to see examples of their work. So let's say you go into a doctor's office or a med spa or wherever, and they're trying to push this procedure that tightens the skin. Well, my question would be, can you show me 10 before and after pictures of a patient that looks like me, has the same concerns as me? Can you show me what your work looks like? And if they can't, the device that they're pushing either doesn't work or they don't have enough experience to use the device. So I think it's very important from a patient perspective to always ask to see examples of the person's work that's going to be doing your work. So this patient came in literally yesterday, and I was like, wow, you look amazing. I really want to use your pictures for my webinar. So she's a younger patient in her early 30s, but basically she had a very poorly defined jawline, and she had a lot of fullness underneath her chin. So this is literally the after photo is 26 days after her procedure, so not even a month. And with this procedure, you see immediate improvement, and you'll see continual improvement and tightening for about 6 months, but you see a lot right in the very beginning. So it's like instant gratification. Like her before picture, no jawline. It was like almost as if the face went straight into the neck, and now she's got this nice, crisp jawline. You can see how the fat underneath the chin is much better. This is the other side, of course, but I mean, I was really, really thrilled. I'm like, she gave me permission to use her photos today, so I was thankful for that. Here's now an older patient in her 50s. These are all my patients. Every before and after is after one treatment. So, like I said, I've been on this procedure for 10 to 12 years, and it's extremely rare that even in that duration that I've done a second treatment on a patient, because you get really long-term results that last several years with this procedure. So again, I like to show a lot of photos. You can see how much better her jawline looks, how the area underneath the chin is significantly better. I also did some laser work on her face. That's why she's a little bit pink still. But I mean, it's like a completely different jawline for her. It went from indistinct to very crisp and nice and clean. Here's an example. I wanted to show this photo. This is a patient that I performed the procedure on before. Then just 3 days later, you can see it's like she looks way better, but you'd never know she had a procedure done. There's no bruising or very, very little. You can see if you look closely about an inch below her ear at the jawline's a tiny red dot. That's the entry point for the cannula and for the ThermiProbe. So like I said, it doesn't leave any scarring. There's no cuts. There's no incisions. There's no stitching. This is the same patient. Again, 3 days later, you can see maybe a hint of bruising on her neck, but that's it. She can easily apply makeup, go to work, good to go. Here's a patient. I like to show different time durations. This patient's 5 months out from a ThermiTight with micro, and I have some different angles for her. So every patient's different. Everyone's anatomy is different, but the basic principles of how to do the procedure for me are the same. So a huge difference in our profile. The only way you could approach getting this type of result would be doing something surgical like a face and neck lift. But beyond that, there's no other way. There's no other procedure out there that can do this on a neck. Different patient 4 months later. Again, she really had a poorly defined jawline. You couldn't even see the jawline near her chin. Now you can see it looks so much better. She'll continue to improve for another couple of months and get more tightening as time goes on. This patient I saw not too long ago, she came in for her 1 month follow-up, and you can already see a dramatic difference. But remember, she's going to continue to tighten and improve for another few months. So she had a lot of fullness and hanging skin. We'll go back to the front view. You can really see it there. And particularly, of course, on the side views, you can see quite a bit of difference already. Different patients showing a 1 month result, pretty dramatic again. Just repeating the nice crisp jawline, and then of course the tightening of the area underneath the chin. And this patient actually is one that didn't really have much fat, but just got the nice tightening effect from the ThermiTight probe being applied to that area. Here's one that's 6 weeks out. Again, already showing a nice correction or improvement in her anatomy. This one, I believe, is about 5 months out. Huge difference on all views. This one, she came in again. This was about 3-month follow-up for her. And gosh, the total, I mean, again, her chin basically connected to her neck. You see now there's complete separation. She looks so good. These are just different angles, different patients to give you an idea. I've done so many of these, I could, show probably hundreds and hundreds of before and after pictures. It's another reason I love this procedure is it's repeatably, you get consistently good results in everyone if you pick good patients, I guess is what I wanted to say. So it is key to pick patients that are good candidates and have realistic expectations. Is it a facelift? No. But, in town here in San Diego, there's plastic surgeons that are charging $150,000 to $200,000 for a facelift. So obviously a lot of people can't afford that kind of procedure. This procedure is budgeted, so it's affordable to almost everyone. So that's another reason I really like it, because you can get a really significant change without breaking your pocketbook. This patient I did some laser work to take care of. You can see all that mottled red discoloration. So I did some V-beam laser in conjunction with the ThermiTight procedure. This is the other side. So she got a lot less red with one treatment. This is one's about 5 months after. A lot of these photos you'll find on my Instagram, which I'll give you at the end. You just basically, if you type in my name, Dr. William Groff, into Instagram or Facebook, you can access all these photos. I have my own YouTube channel. So if you go to YouTube, you can type in my name, and there's videos in there of me doing all the different laser treatments that I do. Here's a patient. She was in her 70s. Again, she wasn't interested in surgery. She had some medical issues and things. She didn't want to undergo general anesthesia and getting cut, big incisions. Now, you got to remember, when they do a face and neck lift, they usually start the incision here, come down in front of the ear, go all the way behind the ear and into the hairline. So they just mobilize all that tissue. So it's a big procedure. So this is her 5 days after ThermiTight that I did on her. You can see, look at the tightening effect already. And this is still swollen through here. So she's got a little bit of surface bruising as well, but she already looks dramatically better. She's thrilled. And that's why she let me use her pictures, because she was so ecstatic. I mean, look at the fullness underneath her neck and the laxity. And, the interesting thing is this procedure is great. I have patients that are in their 20s all the way up into their 80s, and it works for patients throughout that entire age range if the physician picks the right candidates. And, of course, does the right procedure and does it properly. Those are important aspects as well. So here's a younger patient, 33. She just had a little bit of fullness she didn't like. You can see 1 week, you already see a big change, but 2 months, it looks even better. This is the other angle. This patient was 31. So again, very young, but a lot of this is genetic. A lot of patients have this fullness here. They can be in perfect shape, work out every day, but this does not go away without some kind of intervention. This is the side view of that same 31-year-old patient. The other side. This one's 39. You can see it's really transformative for her. It's amazing. This is one of my favorites, I think. So just resculpting that area with ThermiTight probe and with a little bit of the micro-liposuction, she did amazing. Again, you can see the definition of the jawline and the tightening of the skin underneath the chin. Well, this patient, I did use a little bit. If you look at her chin very closely in the pre-photo, it's a little bit on the, what we'd say, small side. So we decided to proceed with putting 1 syringe of filler in her chin to give her a little bit of chin projection. And I did the ThermiTight procedure, and the combination worked beautifully for her. This is the straight on view. Again, you can see this little bit of fullness, how much better that looks in her jawline again. Looks really nice. So probably I'd say 90% of our patients are female, but we have men that come in, and this is certainly a great procedure. A lot of guys have no interest in getting a facelift, for example. They don't want the incisions, they don't want the downtime. This is a great way to take off some age and just help them look healthier and younger, honestly. So Just taking off that little bit of fullness and creating that jawline does wonders for men and women, really. This guy was in his 60s, and could he have maybe had a face and neck lift? Sure, but he didn't have any interest in that. So, I told him, I'm like, look, we can get a really nice result. It's not going to be maybe quite as tight as a facelift, but it's going to look awesome, and it's going to look a lot better. And it's not going to cost $50,000. So, yeah, if you price facelifts, face and neck lifts in San Diego in the very low end, you might find one in the high teens, but more commonly, I'd say they're in the 30 to 40, 50 range. And on the high end, which is ridiculous. There's people out there charging 150 to 200, which is craziness. So one of my jobs as a physician, I have a lot of patients coming in for consultations. And if I don't have a procedure that will help them, I won't obviously tell them to do that procedure. But there are a lot of med spas and places out there that will push procedures. I probably turn away 3 to 4 patients a day saying, look, this isn't right for you. You probably need something surgical, whether it's an eye lift, whether it's a neck lift. I'm always going to push my patient to do the proper procedure, not the procedure that I can do necessarily. So I like this. So this guy, he was only in his 20s, but he had that genetic fullness. So the below picture he sent me, he flew in to see me from out of town. He was in New York and he was at a club, and one of his buddies took a picture with his cell phone, and he sent me this, and he was like so impressed about how much better his jawline looks. So I just thought it was kind of a neat story that he sent me this from a nightclub to show me how happy and confident he felt with his new jawline. So one of my favorite things is to combine ThermiSculpt for the neck with facial lasers. So for this patient, she's 1 month out. I did what we call Take 10, which is a laser resurfacing procedure that takes 10 years off the face. As you can see, it tightens the skin, it tightens the upper eyelids, and smooths the skin and the wrinkling of the skin. It removes all the sun damage and precancers too. And then you can see the tightening effect from the ThermiTight MicroLipo. So it's a beautiful combination for patients who want to have facial rejuvenation as well as neck tightening and don't want anything surgical. And, surgery does not correct texture of the skin, and it will not fix lines around the mouth. Only the lasers can do that. These are just close-ups to show the improvement in texture and the tightening effects underneath the chin. Here's a patient who I did some laser. I did V-beam for the redness, and I did some Fraxel laser with Alexandrite for the brown spots, and then I did the ThermiTight on the neck. And you can see she looks awesome. She looks like herself. She doesn't look overdone, but she looks great. Here's another patient that I did the Take 10 laser resurfacing. You can see how it tightened the skin through the cheeks, reduced all the lines around the mouth, and then the tightening effect from the ThermiTight on the submental or chin area. And again, a lot of these pictures, most of them were on my Instagram or Facebook or on our website here at the CL Derm website. This is one of my favorites. She's about 3 weeks out from laser and ThermiTight. You can see how much better her neck looks, the neck lines, the tightening effect, of course, the wrinkle reduction from the lasers around the mouth. That's a whole separate webinar. So I do have a whole separate webinar on the Take 10 procedure for the face for facial rejuvenation, which you can find again on our website or my YouTube channel, for example. Or my Instagram, if you click on the links at the top, it'll take you to the other webinars. So again, a combination of the Take 10 with the ThermiTight for the neck. This is one of my favorites. I saw her probably about 3 or 4 months ago. And so I did the combination resurfacing of the face. You can see, again, the tightening of the upper eyelids, the tightening and smoothing effect of the lower lids, dramatic wrinkle reduction of the face around the mouth, cheeks, removing all that sun damage, all the precancer spots, and then the tightening effect on the neck. So it's a really nice combination, again, for someone who wants to take years off, feel good, feel younger, look younger, and not do anything surgical with cutting. And this can be done under local anesthetic as well. So what would be an example of someone who's not a good candidate for ThermiSculpt? So if you look at your neck and when if you make certain movements with the mouth and you see these platysmal bands popping, those are muscular bands. So there is no non-invasive way to address those. So if you have just the bands going down the front of the neck, that's something that has to be addressed surgically. But that's a very good example. A common thing that patients come in with. Now, something that does help that if you don't want surgery, we can put Botox in those bands and it flattens and relaxes the band. Of course, it's temporary, so you have to repeat it every 3 or 4 months, but it certainly is a great alternative to doing something surgical. So this is where you can follow and check out all my before and after pictures, whether you're on Facebook or Instagram. Then you go to YouTube and watch any of my webinars. I have a lot of footage of me performing all the various procedures that I do on YouTube. So, Reese, I think we could take questions now.
Perfect. You finished so quickly. That was amazing. All right, guys, this is great news. That means you all have a lot of time for live question and answers. So I already have a number of them in here. If anyone wants to take a screenshot of Dr. Groff's handles here, I'm going to take this down so you can see him a little bit better. And this is the time to pop in your questions. So let's get to it. All right. What if you don't have fat in this area, but just skin laxity?
It depends how much laxity. I mean, I did show a few examples of patients that have just primarily skin laxity and worked really well for them. But if you actually pinch this area and then pinch, say, over here, if there's the difference in thickness between this skin and when you pinch here, that's fat. Almost everyone has some fat there that can be removed and make that angle look so much better. So like I said, pinch here, look on right now, and then pinch over here. I have a little bit of fat there too. So someday.
Yeah, so do I. All right.
Right.
Gotta work on that. Okay.
Not good.
All right. So how about treating the jowls?
Yeah, the jowls will respond. They don't respond as dramatically as along the neck and underneath the submental. But again, if you flip through my photos, you'll see a lot of patients with some nice jowl reduction.
Okay. Can the same concept of treatments work for crepey skin elsewhere on the body, like the upper inside of the arms or on the thigh?
For me personally, I don't like it for that, but I think there are some doctors that will do that treatment, but it's not for me. I haven't found it, in my opinion, to be that impactful, so I don't do it.
So what do you offer anything for crepey skin elsewhere on the body?
I mean, I like topicals. I think topicals are relatively inexpensive compared to lasers, so I use topicals myself. I like the Skin Medica body lotion. That's what I use. And I also we have a body lotion that has retinol in it. So that helps too. But I mean, honestly, the crepiness on the arms, legs, on the body is still kind of the holy grail of our specialty. You'd have to spend a lot to get not so impactful of a result. So I kind of try to steer patients away from it.
Okay.
Yeah.
I'll pop a link to the Skin Medica Firm and Tone lotion. Is that the one?
Yeah, that's what I use.
Okay. I'll pop that here so you guys can all see it.
Yeah.
All right. That's good to know. I haven't tried that one. All
Oh,
right.
it's really good. I like it.
Yeah. How far down does the probe reach? I have crepey skin from the collarbone up. Would it reach that area?
Well, we usually just go to the base. I mean, it depends on the patient's anatomy. We don't usually go into this collarbone area. Again, because if you have crepey skin here, there's probably a surface laser that I'm going to use. I'm not going to use the ThermiTight. The ThermiTight's strengths are tightening the skin along the jawline and submental and a little bit into the jowl area. Not for crepey skin down here. I'd use laser for that.
But we definitely can treat that, and you should
Oh,
watch.
for sure, 100%.
Okay. So how does the ThermiSculpt compare to using filler to improve your jawline?
Well, they're kind of two different things. If you have fullness here, fillers aren't going to do anything. If you have laxity here, fillers aren't, you can only put it so much filler before it looks ridiculous. So you'd have to put a ton of filler up here to lift this skin here. It just isn't happening. So it depends. Every patient, that's why we do consultations, because everyone's anatomy is different. You know, you may benefit from one more than the other, but I won't know that until I examine you. But if there's fullness here and laxity, it's going to be ThermiTight, not filler. Filler can help create a nice, crisp jawline, though, in the right individual. That's true. We do a lot of that.
All right. Let's see. Can you use this laser other places on the face to tighten loose skin?
Again, I don't think many people do. We usually don't go beyond treating the jowl area. So it's primarily upper neck, submental, and jowl, but
Okay.
not up here. No, that's where we get into laser resurfacing. So like I was saying at the end of the talk, if you look at my ThermiTight, I'm sorry, my Take 10 webinar, which it's the laser resurfacing procedures that we do to tighten and smooth the facial skin, that's a much better option.
I'll send you guys, I'll pop a link in for that webinar as well so you can see it. Okay. I think you've already said this, but just to be clear, is this ThermiSculpt effective for a turkey neck?
Absolutely. I think that's what most of those patients.
That's the bread and butter.
Right. Yeah.
So yes, yes, and yes. All right. This is an interesting question. Is someone that had a total thyroidectomy a candidate for this? So that means they had thyroid surgery.
Right? Yeah, that's not a problem.
Okay, great. And we do, where do we do these procedures and kind of what kind of safety precautions are in there before we put someone in under?
Yeah, so we have 3 fully accredited operating rooms. So we have everything we could ever want and more. We actually have way more than we could ever need or use in our operating rooms because they're credentialed as if we're doing surgery, and we have all the crash carts and everything that we need, but it's overkill. But we have everything, so there's no concern there. Yeah. We actually just passed our recertification for all of our operating rooms today.
HC, I think.
Today we had the second day. It was a 2-day process, and our OR team is amazing. Our nurses are amazing, and they had everything squared away perfectly. And so we just got re-credentialed for the next 3 years today. So Lindsay, who's our head OR nurse, did an amazing job.
Yay, props, Lindsay. Yeah. And just so you guys know, this is super rare. I would have bet that there's very few of these in San Diego like us.
Yeah, and honestly, most places that do ThermiTight, they don't do it in a credentialed operating room. Yeah. We do. And we developed the whole ThermiSculpt concept of combining the MicroLipo and ThermiTight. So most people don't even do that. So it's a totally different procedure what you're getting here.
Mm-hmm. Yeah, you cannot find this procedure elsewhere. Agree. All right. So does it matter if you have a different skin color for this? Like if you're olive complexion or darker skin tone?
Yeah, that's a great question because a lot of the lasers are skin color dependent or not safe for certain skin types, whereas this can be done on any skin type safely. From the lightest to the darkest, no problem.
So how long will the results last?
Well, I said I've been doing them for I think 10 to 12 years when that device first came out. I've only done 1 or 2, maybe 3 repeats. And honestly, those patients that I did a repeat procedure on, they still look better than when I did them several years ago. So it's a long-lasting procedure.
All right. In case you're not happy with the results, could you do it again? And if so, how soon?
I would probably, if a patient wanted further improvement, I'd wait at least 6 months because you're going to see continual improvement for 6 months. Yeah. So minimum of 6 months, but that would be really rare.
Okay.
For someone to be unhappy and want to do a second one.
How about if you're older, like if you're 72 years old, are you still a candidate for a procedure like this?
Well, yeah, I mean, if you look at the before and afters, I have a lot of 70-year-old patients in those, even in this presentation, or 60s to even 80s. So yeah, I have 80-year-old patients who've done this.
Love it.
But then I have 25-year-old patients that do it. So really, it's the whole gamut of the age range.
Does the face always is it more shiny after laser?
That's a temporary. That's from using using a lot of skincare products to hydrate this skin. So no, it's not shiny at all.
Okay. Unless that's what you're going for. Some people like
Well,
that
if you
dewy
want,
look.
yeah. I mean, but the truth of the matter is that skin that's sun damaged and dull and crepey and wrinkled doesn't reflect light. When your skin's smooth, tight, young, not crepey, not sun damaged, you get a really good reflection of light. Dull, sun damaged skin absorbs all the light. So you want some reflection and shininess to your skin.
All right, that's interesting. All right, here's another really interesting question. So can this procedure, does it remove volume in the jowl? I had air sculpting done and I feel my jowl still needs help.
What did
And
they have? What did they have done?
air sculpting.
I'm not
It's
sure
like
what that
this,
is, but
let's see.
what kind of sculpting?
You know, it's like a new marketing term.
And it
It's,
sounds like
yeah.
yeah, I mean, if you had a procedure done that you're unhappy with, typically I'd say wait 6 months and then you could proceed with some different alternative to help with the problem area.
Okay.
Yeah.
Let's see. How would this treatment compare to therapy or thermage?
Well, therapy and thermage are devices that deliver energy through the surface of the skin. Um, ThermiTight, we're working directly to the undersurface of the skin. So it's a more effective procedure. I mean, I don't think anyone would ever tell you that they can show you pictures like I just showed you doing Althera or Thermage. They don't exist. But, the advantage of Thermage and
today,
Althera is you don't have to go underneath the skin. You don't have to make a poke. You're not working underneath the skin, but, you give up the impressive results that you can get with ThermiTight. What I tell patients, we have Althera and we have Thermage, and I love them, and I've been using them for many years, but they're more preventative maintenance treatments. You're not going to see dramatic lift and tightening in the majority of cases with those technologies. The before and afters just aren't out there. And usually the before and after pictures that I've seen online of dramatic lift with Thermage and Althera is usually because the patient's still swollen post-procedure, because swelling lifts tissue. And when the swelling goes down, it ends up looking about the same.
Yeah. But the best part is since we have Thermage, we have Althera, we have Soft Wave, and we have ThermiSculpt during a consultation, you can talk
Yeah, we
about
have everything. So we're not biased
exactly
towards anything because we have all the options. And, that's where it comes down to consultation and we figure out what best fits your lifestyle and your physical, whatever you need physically.
your goals.
Yeah.
So does it impact anyone's smile?
There's a possibility any procedure, it could be Althera, it could be Thermage, anything that you do on the neck, there's a nerve that runs from here along the jawline up to the corner of the mouth. It's called your marginal mandibular nerve. And it certainly can be impacted by surgery. Surgery, that nerve can be damaged permanently. With the procedures that we're doing, the non-invasive, minimally invasive, if that nerve gets inflamed or bruised, it can temporarily not function properly. And when you smile, you can have a little bit or sometimes a noticeable crooked smile, we'll call it. And that can last a few to several weeks. It's probably the chance of that happening with this procedure are probably about 1%. And what happens, it's temporarily annoying for sure for a patient, but it's never permanent. The longest I've ever seen one last between me and all my colleagues here is probably 3 months.
Yeah.
So that's probably the worst thing that could happen. That's the worst thing I've seen is a crooked smile for 3 months. But that can happen with any procedure, not even the non-invasive procedures on the neck.
Mm-hmm. All right. Someone else is asking about colored skin, darker skin tones, because they're concerned about hyperpigmentation and keloids. Can you address that one more time?
Yeah, not an issue with this procedure.
Yeah, certain lasers.
Save for all skin types.
Yeah. But we understand certain lasers, it definitely is a concern. And because we have over 60 lasers in the practice, we definitely have many that are specifically for darker skin types.
Exactly. Yeah.
Can you do RF microneedling after Thermi? And if so, how soon after?
Yes, I would wait probably 6 weeks.
Okay. So you said it takes months to see full improvement because it continues to improve. So is there
Right.
healing happening during that time?
Yeah, there's part of wound healing is wound contraction, and contraction meaning tightening, right? So when I'm passing that probe throughout the neck, it's creating a wound below the skin that you and I can't see. So that's part of the reason you get this nice tissue tightening effect.
All right. Let's see. Someone is saying, how much is a consultation? I can help answer that. A consultation is $250, and that is applied towards any treatment that you get. So that's paying kind of for Dr. Groff or any of our physicians for their time to really do a personal consultation with you. Um, let's see. So someone's saying, is this essentially liposuction? How is it different than just lipo?
Well, with liposuction, which I do, um, you're not doing anything to tighten the skin per se, in addition to just doing the lipo itself. So the ThermiTight adds the addition of the heat, which we discussed in the beginning of the procedure. Heat, if you could heat the tissue underneath the skin to 55 to 65 degrees Celsius, you get tissue contraction and collagen contraction. And so that's really a huge difference between just doing lipo and doing our procedure.
Got it. So you said you can drive yourself home after the procedure.
Definitely.
So what do you look like? Do you have like elastic bandages on or?
So after the procedure, we put a supportive piece of tape that runs under this area and goes up to about here, like this. And then for 24 hours, that stays on for 2 to 3 days until it falls off. And then we usually have you wear a band that goes up and adds some extra support, like this direction, for 24 hours. So not bad at all.
All right. Um, let's see. What is the size of the cannula for this MicroLipo? Is it the same size as Thermi?
You can't, yeah, if you want to go back to, well, you'll be able to go back and watch any part of the presentation. I had a graphic there that actually showed the size of the probe and the size of the cannula. The cannula, the probe's probably about this long, so about the size of a ballpoint pen. There are different sizes too, but that's primarily the one I use. And it's like about as wide as a piece of spaghetti, so it fits right through a little poke hole. So we use the same size to make this little poke hole here. We use the same size needles when you get your blood drawn. So, I've gotten blood drawn out of this arm probably, I don't know, 100 times in my life, and there's not a single scar there. And that's why there's no scar when we do the ThermiTight.
All right, I'm popping the link in here for you guys to make an appointment online. Okay, what else is the aftercare instructions other than kind of going home with that bandage?
Just taking it easy. I wouldn't do any vigorous working out for probably 3 to 4 days, but that's pretty much it.
All right. Do we have any photos showing patients after many years, maybe after 10 years of this, after this procedure?
Not on my presentation, no, but I have plenty. I can find some. But, we lose track of patients after, if a happy patient, if a patient's happy with the procedure, they may not come back for 10 years. People just don't go to the doctor's office or the heck would say, hey, I'm still doing great 8 years later. Fortunately, I wish they would.
So maybe it's a good sign, but I don't even think,
Yeah.
has Thermi even been around for that long?
I don't know. I was trying to think about that. I can't remember
Oh.
the exact year we got. I think it's in the 8 to 10 year range.
Um, all right, I'll try and Google. So let's see. A lot of people are asking about pricing. I know this is a tough question, but what can you say? Any idea on range or anything?
I'd say it's in the 45 to $6,500 range.
Okay. Thank you for saying that. Now I need to add a
Sure.
disclaimer. Every single treatment is customized, and some of you may be watching this webinar years from now. So that is the price as of
But
now.
it's not the $200,000 facelift, a neck lift that you can get locally. So
No, I mean it's actually very cost effective if you consider how much a
oh
neck
yeah,
lift would be or something else.
for sure.
Um, Can you get this ThermiSculpt done at the same time as you get some laser work done on your face, chest, and arms?
Yeah, that's one of my favorite things to do. So at the end of the presentation, you might have missed it. I had probably 7 or 8 patients that had done facial resurfacing in combination with the neck, and it's a great combination. So yeah, I'll frequently do face, neck, chest, hands, arms, all in one day, all in the same patient. Just it's one treatment and done. You don't need to come back multiple times. I really like we can do it that way, but the best way to do it is to do the best job that I can do in one treatment session, doing the face, neck, chest, hands, arms, all in one shot and be done with it.
Yeah,
But we can certainly break it up too.
that sounds great. I have seen sometimes that too much fat gets taken out under the chin and then it looks hollow. Do you kind of eyeball how much fat to take out and then proceed, or how do you make that determination?
Yeah, it's basically, I mean, it's a matter of, I guess, knowing what you're doing and taking enough, but not too much, right? It's just like when I do laser resurfacing. I have to know that I can go this deep, but don't go too deep. So it's a matter of that's why it's important to find someone who has experience because like anything else in life, the more experience you have, generally the better you're going to be at doing something. So I won't want someone resurfacing me that hadn't done a lot of cases or a lot of thermi cases. So it comes down to experience. But I've never, thinking about your question, I can't honestly think of one single patient that's ever come back to me and said too much fat's been taken. It's never happened, but I understand your question.
Yeah, no, we love fat. We have lots of fillers we're injecting.
All right, right. But I've never had anyone say that we took too much from here. Never.
Yeah, I don't know. I don't know either. I don't think you could take enough.
Right. Yeah.
Okay,
But
you said someone 72 could do this. She said, how about me? I'm 85.
yeah, 100%. I mean, I have a few patients on my Instagram or Facebook that are in their 80s. And the nice thing about doing it, an 85-year-old, you don't have to go under general anesthesia for this procedure. It's all done with local anesthetics. So there's no risk. You're not facing the risk that you would, again, having a face or neck lift where you have to go under general anesthesia.
Absolutely. And just so you guys know, we were running some reports the other day. We actually have a number of patients that are well into their upper 90s that are current patients of the practice and see us all the time. So there is no limit to how you want to feel confident and good in your own skin. All right. If I am located out of the country, can I do a consult virtually? And will that be enough for you to make recommendations before I fly out?
Yeah, so in this day and age, the iPhone, for example, or any of the cell phones, the cameras are so amazing that patients can just send me photos straight on, angled shots, and I can usually make a plan based on that. So yeah, I do virtual consults pretty much every day.
We just need to take off those filters and show you the real deal, I guess.
Right. Yeah. Yeah. Exactly.
All right. A couple more questions here, and then some people have some stuff that's more related to Take 10. So do you ever fit Sculptra into the equation with Thermi and MicroLipo?
Well, that's a whole different animal. I mean, Sculptra is usually used for areas of fairly large volume loss. So we'd use it in the lower face, temples, things like that. But absolutely, you could do it the same day.
Yeah, beautiful. All right. So a couple people are asking a few more questions. So can you talk more about your opinion on radio frequency microneedling, RF microneedling?
Well, it's such an open question. I mean, that's where a consultation comes into play. We're talking about for acne scarring, skin tightening, anti-aging. I mean, that's a whole different conversation.
But in general, for the right person, we do
Yeah,
offer
we have it. I mean, we have like 3 different microneedling machines. So, if you're a
RF.
good candidate for it and that's something you're interested in, you definitely have it. Yeah.
Yeah. So, all right, back to kind of some laser stuff. Can't you use Fraxel to improve the skin texture on arms and legs? Do I really need like a more aggressive Take 10?
Well, Take 10 it's a face procedure. With the lasers that we use for Take 10, we don't use them. arms and legs. So you can't. It's just facial skin is totally different than body skin, to put it in the simplest terms. Sure, could you do Fraxel to help improve the texture of the arms and hands? Yes, but you have to be willing to do it multiple times. It takes usually several treatments to get a patient where they want to be with, say, the Fraxel laser and wanting textural improvement on the body. So it can become quite expensive and time consuming, but yeah, absolutely, we can do that.
Okay. All right. This is a different question, but do we have any methods with lasers to create similar results to a surgical lip lift? Raise the lip.
Well, absolutely. If you look, again, if you go maybe on my Instagram, YouTube, CL Derm website and look at my before and after pictures of patients who've had Take 10, many of the patients, you'll see the distance from the nose to the upper lip is shortened. Or you'll see where the patients look like the lips slightly enlarged and smoother, but that's all from the laser with no fillers. So yeah, definitely.
All right. So let's see. Some people are asking about Take 10 because they know you're very famous for that. So what is the downtime after Take 10 in comparison to this Thermi?
It's definitely more significant. I mean, it's Take 10's more like you need 8 to 10 days where you're not going out to be healed. So it's you're not in any pain or anything. It's just you're socially basically you're not going to want to be out and seeing people look at you as your skin's peeling, right? So you gotta be willing to go into hiding for about a week. Which to get 10 years back is certainly worth it. A week goes by like that. It's like, think about how fast last week went by. It's like ancient history.
That's true. That's true. All right. What lasers would you recommend for someone with olive skin tone?
Again, I mean, it's the huge open-ended questions. You're looking for textural improvement, brown spots, do you have broken capillaries? You know, that's why we have 60 different lasers. So we have lasers for all skin types. That's where the consultation comes into play.
Could an IPL ever be used for someone with olive skin?
Sure.
Yeah.
Definitely.
It's more about if you're tan or not, right?
Well, yeah. Again, it depends what's going on with your skin. Is it brown spots? Is it vascular? Is it wrinkles? You know, there could be better modalities for olive skin for those.
Yeah.
What your problem is.
All right. Oh my gosh, we got through 47 questions, you guys. Good job, Dr. Groff.
Wow.
That was like a round robin of them. Thank you so much. I know we have more to go, but this was great, very helpful, very educational, and I hope you guys can see, you know, this ThermiSculpt really is a very amazing procedure that was developed only at here at Cosmetic Laser Dermatology, so you can't find this elsewhere. And if anyone else says they're doing it similar or doing something like it, I would say what Dr. Groff said. Let's look at their before and after.
Show me the proof.
Compared to ours. Yeah, show us the
pictures.
Proof.
Lots
and
of
show
photos.
me more than one or two photos. Show me dozens and dozens because we probably have, I don't know. We have thousands of photos on our website.
Thousands, yeah.
Yeah. Otherwise, people are saying, thank you, very informative.
Great.
I did post a link for how to book an appointment with Dr. Groff because it is after hours here in San Diego, but you can book online. And if you live out of the city or out of state or out of the country, you definitely can do a virtual consultation first. We have lots of patients that fly in from all over the world. We have relationships with hotels. We can help you get coordinated everywhere. And I also posted a link to the Take 10 webinar that I encourage a lot of you to check out because a lot of you had many questions that overlapped. Otherwise, I hope we see some of you for a consultation with Dr. Groff for ThermiSculpt or with any of our doctors at CL Derm. And Dr. Groff, thank you for taking your time. I know you had a busy
thank you, Risa.
day.
Appreciate it. Thanks for everyone for logging in.
Yes, we hope to see you at the practice soon. Bye, guys.
For sure. Bye-bye.